Now looking in depth at maybe the single biggest question around the world right now. When do we get the vaccine? And we have the man who knows more about it than anyone in Utah right now. But first, a couple of quick pieces of information. In Utah, phase 1 of the vaccine is underway. The first dose is going to frontline healthcare workers and staff and some residents of long-term care facilities. The staff of K through 12 schools next, and first responders and public and tribal health workers. Now nationally, 12.4 million doses have been sent. 2.6 million people have gotten shots. In Utah, the numbers are 125,000 sent, 24,000 shots. Very similar in the rate of vaccination. Now, the man who knows so much here in Utah is overseeing all of this. Rich Lakin is with us right now. He's the immunization director with the Utah Department of Health. And Rich, thank you for joining us. I can't imagine how busy you are these days. Those numbers put us at about 20% of the vaccines that we have put to use so far. Is that where we should be?
Well, I think we've kind of started a little bit slower than what we would like, what we had anticipated. But remember that the reporting requirements, there's a huge lag in that reporting. And so even though it shows 23,000, I think that is very low compared to what we would expect. I think we are above the national average. And I think we're more up in that 30 range. But again, we've just had that lag in reporting and we just don't have accurate numbers right now. But the 23,000 is what is actually reported now.
Okay, so those different regional health departments, they're going out giving the shots and probably prioritizing that and getting the reports in later. What, you said that health workers today in a press conference that you held should call their health departments and schedule a shot. Do those workers know who they are? How do they find out if they're the right people to qualify?
Yeah, so these non-hospital healthcare workers, anybody that would be classified as an MD, DO, nurse, a medical assistant, physical therapist, occupational therapist, dentist. I mean, it's a large umbrella. And so it is a little bit difficult to get the messaging out there who would really qualify as a healthcare worker. But, if they have direct patient care, then they would be classified as a healthcare worker, and they would need to contact their local health department to get vaccinated.
And one thing that you mentioned is that we're a little bit delayed. We've gotten 40% less vaccine than we thought from the federal government. So what kind of delay is that giving us? How long is it going to be before, let's say, our parents and grandparents, those 75 and older, start getting their shots?
So I think once we get through this phase 1, towards the end of January, we're looking at, like you had mentioned, first responders and teachers. We're hoping that we can reach that milestone, which is somewhere around January 25th. And then we're going to move into, once that occurs, we're anticipating that may take about, let's say, 3 weeks. Again, these are some of the assumptions based on how much vaccine we're receiving. And then we'll move to that age category that I talked about earlier, which will be 75 and older. And I believe that hopefully that'll be in mid-February.
Mid-February, okay. And we've heard reports out of Wisconsin that a pharmacy there, because they had doses out and once it's not in that deep freeze, they have to use it within 5 days, started giving it to people who weren't at that priority level. Is Utah having those issues? So
I can tell you what local health departments are doing, and I know that some of the hospitals are doing this also. When you draw a vaccine out of the vial and you have so many lined up to receive the vaccines, and you've got 2, 3, maybe 5 doses left over, you go find somebody that can get that vaccine into the arm. We do not want wasted doses. Local health departments actually have a emergency contact list of where they will have people that they can contact immediately that can come within an hour, maybe 2 hours, that can get that vaccine. So that's kind of our priority and how we're moving in Utah. If it means that it goes a little bit outside of that priority group, then okay, but they should try to vaccinate within the priority groups within that phase.
Okay, Rich Lakin, we are out of time, but really appreciate you taking some time for us. We all have have some skin in the game here. We want you to succeed, so please let us know so we can let our viewers know as things change. If you need to get the word out about people needing to get signed up for this.
Yep, I appreciate that, and really look forward to working with all media. So thank you.
Thank you very much.